It's a wonderful turnout for the first session on a last day of the conference. I'm really pleased to see you all here. And I'm very pleased to be here because this topic is an exciting one and really can mean the start of a really deep change in how we serve in long-term care our elder and disabled individuals in Virginia. So I'm really pleased to see you all here, and I'm very pleased to introduce to you two people that I just met this year working on this project, and have just been delighted to work with them because they are both dedicated and clever individuals who have been shepherding this process. To my left is Julie Stanley. Julie is the director. I'm going to flub this, aren't I? I even practiced. The director of the governor's office, and I don't, okay. Here, I can do it. Director of Community Integration for People with Disabilities in the Office of the Governor.
Correct.
I had to read it. I'm sorry. I really did try. And she's responsible for staffing a broad-based group that is working on trying to make Virginia's communities a better place for our individuals with long-term care needs, and has a long history of working in state government, which you all can read at your leisure. What I appreciate about Julie is that she's so clearly dedicated to this issue, and that she has a warm and wonderful way of bringing together people with diverse perspectives in pursuit of that goal. And to Julie's left is Jason Rachel. Jason, I'm just going to read his title. He's director of the Money Follows the Person project in the Department of Medical Assistance. And I gave Jason a left-handed compliment at breakfast this morning, saying that he was unlike any other DMAS individual that I had met. He wasn't sure how to take it, but it really was a compliment. DMAS, poor DMAS, even worse than DSS, sometimes is a prisoner of federal regulations that can be very rigid and difficult to work with. And I've had a peek into that process in working on the Money Follows the Project, and I have great admiration for the folks in DMAS who deal in that system and still manage to make services that get delivered on the ground. So it's a challenging, I have a greater appreciation, I think, for the challenge that folks in DMAS face as they try to do that. We're here today to talk about Money Follows the Person, systems transformation, all kinds of words that you've been hearing bandied about. But for me, the telling piece is that even though the aging population has gone up, our use of nursing homes has gone down over time. There are cost constraints that certainly drive the federal government in that direction, but more and more it's the fact that people want to be living in their communities, living with their families, living with their friends, and that we as a society need to support that approach to life. And that's what makes this process exciting.
It's called Your Life, Your Choice, Your Home. And the reason that it's called that is because we're trying to boil down three major federal initiatives that we're trying to implement in Virginia to the level where individuals who use services in the long-term support system can actually understand the impact that we're trying to have on their lives. And in the process, we want to make sure that agency staff and providers of long-term support services also understand the impact. First of all, what are the long-term support systems in Virginia? I know most of you probably work for social services departments, which are a very, very huge piece of the long-term support system. But it also includes private agencies that deliver services, oversee, pay for services for seniors and people with disabilities who are seeking some type of assistance with the activities of their daily lives. And in Virginia, one of the things I'll talk a little bit more about in a minute is the fragmentation of our systems. We have a lot of different agencies and services and providers of supports available for different populations of people with disabilities and seniors. And we tried to list as many of those players on this slide as we could. We've obviously got the Medicaid program, which is a huge piece of this puzzle, and from which all three of these initiatives, and by the way, I forgot to tell you the names of the initiatives, but I think Jan covered them pretty well. This is Money Follows the Person demonstration, the Systems Transformation Grant, and another grant that we'll mention at the end of the presentation called the Long-Term Profile Tool Grant. But the Medicaid program is the recipient of all of these initiatives that we're going to talk about. But as you can see, there are so many other agencies and services that we need to impact. So we want to make sure people understand just kind of how many we're trying to deal with at this point. So why do we need to transform our system? I think probably I'm preaching to the choir with this group here. You all probably know more about that than even we do. But again, the long-term support systems in Virginia are very fragmented. People have problems locating services and supports that they need. I know many of them end up in your offices, on your caseloads, but they also are coming to other agencies looking for services and benefits as well. And we found that planning and management and administration of related activities are not always as well coordinated as they could be. When you have so many different pieces of the system, it's very, very challenging and difficult to coordinate as much as you could, because everybody is so busy doing what they need to be doing. Housing and long-term support agencies plan and deliver services in very different systems. For example, in Virginia, the housing agencies fall under the Secretary of Commerce and Trade, and of course the Human Services agencies and DSS fall under the Secretary of Health and Human Resources. So it's very challenging even at the highest levels of government to have the communication and the coordination that's really needed in order to increase housing opportunities for folks. And of course, modern methods of gathering data or using data are limited, so that's another challenge that we currently have. And you all could probably tell me about 20 other challenges that you see every day. Why should anybody care about transforming services in Virginia? Well, I think we all know somebody who is using long-term support services and who might not be exactly happy with their life or the services they are receiving or where they're living. You probably work in the long-term support system and experience frustration because you know somebody needs something and you can't find any service or support to match up with their need. And also, all of us may need long-term supports at some point in our life. So there are a lot of reasons that we should all care, no matter what we do, what our role is, where we live. Everybody should care. All right, what will this transformation mean for me? And the me here is the individual who uses the services, but a lot of what we're going to talk about, I think, is also going to obviously benefit us as folks who work in the system. First of all, and I'll go through these in greater detail, so don't get too excited yet. Instant access to comprehensive information about supports, more choices for community living, and new Medicaid waiver services to support individuals in the community if they qualify. And that's something that Jason will be going over in just a few minutes. So what does transformation mean for people in the future? Now, there are a lot of things going on at the state level right now that haven't been finalized and we're still working on. So in order not to get anybody's hopes up, we just want to make sure that we mention those things. But we're working toward person-centered practices, making people the center of planning instead of what we have to do so often now, and that's make services the center of planning. Faster access to the supports that people want and need, additional housing and transportation choices for people, and no more agency hopping, which I'll explain in a minute. First of all, information. How many of you have heard of Virginia Easy Access? Has anybody heard about that website? Okay, this is a website that will hopefully be up and running by the end of this month. It may be June. But it's going to be one web portal where anybody can go to find any information they're looking for, hopefully. We're trying to make it as comprehensive as possible, about any supports they might need. And it's going to link people, it's going to have pages on housing, transportation, independent community living, disaster preparedness. Again, it's going to be very comprehensive. But if people can't find what they're looking for either on the site or in some of the links external to the site that can be accessed from the site, they'll be able to do customized searches by putting their zip code in to a database called Virginia Navigator, which is Senior Navigator with added information about services and supports for people with disabilities. It's going to be called Virginia Navigator, but it's really powered by Senior Navigator. And there'll also be email support by 211 Virginia from this website for people who still can't find what they're looking for. So be on the alert for information about the launch of the website, which should be later this summer. And I hope that you all find it as useful in your work as I know I'm going to find it in mine. For people who don't use computers, did you all know that 211 Virginia is going to a 24-hour-a-day basis starting July 1st? Right now they operate from, I believe it's 6 in the morning or 8 in the morning to midnight. And they're going to expand their operating hours to 24 hours a day. So there will be a call specialist who can help people who don't use the computer or would prefer to talk to somebody. Okay, the next topic is faster access to supports through development of an online Medicaid application, which should be up and running probably around September, I believe, of this year. That will be on the Virginia Easy Access website. People will be able to apply right there on the website, and the application will be sent to the appropriate local social services department. There'll be a streamlined processing of applications for certain Medicaid waivers, the mental retardation, or now as the term is, intellectual disabilities waiver, and the developmental disabilities waiver have kind of been, they're kind of archaic. A lot of the pre-authorization for services and enrollment is done by fax. So we're trying to get that, bring that into the 21st century. There'll also be an online form that people can fill out to tell them if they might be eligible for certain services, and that's something that is being developed now and won't be available until later. No more agency hopping. How many of you have heard about No Wrong Door? Okay, and how many of you work in offices who are part of No Wrong Door pilot sites? Do any of you? Okay, there are currently six No Wrong Door pilot sites in Virginia, with the goal of expanding to 10 by September of this year. And by 2010, the goal is to have a network of No Wrong Door sites throughout the Commonwealth. And these pilot sites really involve a lot of different local agencies coming together to try to break down communication and other barriers and work more cohesively as a system. The vision for No Wrong Door is that there will be a comprehensive network of aging and disability service providers that collaborate and plan together on an ongoing basis. And there will be electronic sharing of information. One of the things we've been working on very hard at the state level is making sure that all the legal requirements for authorization to exchange information are taken care of so that people will be able to say, yeah, you can share my information with the AAA, or you can share my information with the CSB. Okay, I mentioned person-centered at the beginning of the presentation, and that's another huge initiative at the state level with some training that will be coming out later this year. We're working very hard to get all service systems to place people at the center of planning for their own long-term supports. They will be controlling more of the services and supports that they use, and encouraging family, friends, neighbors to take a more active role in providing what many people call natural supports in the community. And lastly, and I'm going to let Jason take over after this, more choices for community living. If people are currently living in a nursing facility, an ICFMR/ID for intellectual disabilities now, or a long-stay hospital, they're going to have more options to move into the community with the supports that they need. And if they currently use waiver services in the community, they'll also be able to access these new services. So, Jason, you want to come up and talk about those?
Good morning, everyone. Thank you, Julie. Thank you, Jan, for that wonderful introduction. As Julie had mentioned, I will just spend a few moments with you this morning to talk some about the new Medicaid waiver services as a result of Virginia's efforts to transform the long-term support system, and then also get into some of the other challenges with regards to specifically moving to the community, and that would be housing and transportation. So let's start with the new Medicaid waiver services that will be available to individuals. We have two that were designated specifically to assist individuals in bridging the gap between residing in a nursing facility and then transitioning to the community. Those two services are transition services and transition coordination. Transition services is a one-time, lifetime $5,000 benefit for individuals to purchase goods and services that will be essential for transitioning to the community. I think everyone here can perhaps pretty easily remember their first apartment and all those expenses that went into setting up your first household. With, for example, these security deposit for the apartment, perhaps on the rental unit, your utility deposits, setting up your electricity, your phone, your essential appliances, your essential furnishings, plates, sheets, all those things that come in. So this benefit will provide monies for those purchases. And as for the services as it relates to transition services, individuals can get a one-time pest eradication for health and welfare, as well as a one-time cleaning before moving into their rental unit, perhaps. Transition coordination is a new service that will be offered in the ED/CD waiver, which is our elderly or disabled with consumer direction waiver. Many of you in the room who may be working with the Medicaid waiver program here in Virginia know that the elderly and disabled with consumer direction waiver currently doesn't have a case management component, but the MRID waiver, the DD waiver, tech waiver, as well as the AIDS and HIV waiver all do have a case management component. So Virginia will be adding this provider class to the ED/CD waiver so that individuals have someone that can help assist them in procuring those goods and services as it relates to their transition, developing that transition and services plan, and then following them up to 1 year after their transition back to the community to ensure that all the services are being met. If things change over the year, within that 12-month period, they can address those changes. So that's transition coordination to the elderly and or disabled with consumer direction waiver. The agencies that would be enrolling as a transition coordination provider are local government agencies or private not-for-profit 501(c)(3)s, and that this rate will be the same as it currently is for MR case management, which is currently $326.50 per month. So that's billed on a monthly schedule. Then lastly, consumer-directed supported employment. This is an opportunity for individuals who choose to obtain employment to identify their own individual job coach and to assist them in understanding their job and breaking down that role into tasks, and then to make sure that the individual is performing those tasks at a satisfactory level. So these are the 3 new services that will be added as a result of the Money Follows the Person project to the Medicaid waiver programs. Specifically, the elderly and disabled with consumer direction waiver will receive environmental modifications, assistive technologies, and then, as I mentioned previously, transition coordination and transition services. Again, under the Money Follows the Person project and as its role in the Virginia's transformation of long-term support system, environmental modifications and assistive technologies very well might be benefits that individuals would need to use not only in order to transition successfully back to the community, but perhaps to maintain their community dwelling if an incident were to occur. And that speaks to Julie's earlier comment regarding these services, although have been created or added to as a result of our Money Follows the Person project, are available to all current waiver recipients within that waiver. So, for example, if a community dwelling individual is using the services under the EDCD waiver and has an incident, let's say, that requires that they be in a wheelchair, and then now they are having difficulties, they can't get out of their home because there are 3 steps, then before they would not have environmental modifications. Now, as a result of Money Follows the Person, environmental modifications will be added to that benefit, and so they could get that ramp installed. And so it's both an opportunity to transition and strengthen the waiver for individuals who like to move to the community, as well as a diversion for individuals who might be at risk for institutionalization. Our tech waiver will add PERS, which is our Personal Emergency Response System, which is the pendant, I'm sure everyone's familiar with, as well as transition services that I mentioned earlier. And then our AIDS HIV waiver will also add environmental modifications, the PERS again, assistive technology, and transition services. Our DD waiver, Individual and Family Development Disabilities Services waiver, will have consumer-directed supported employment added as a new waiver service, as well as transition services. Our MR and soon to be named ID waiver will have consumer-directed supported employment and transition services. And our day support waiver will also add the consumer-directed supported employment. So those are just a few of the new waiver services or existing waiver services that will be added to other waivers as again, part of both the Money Follows the Person project as well as transforming Virginia's long-term support system. Now, the additional Money Follows the Person services include supplemental home modifications, bridge rent, and the 24-hour backup system. Now, these will be services that will be available to those individuals that are participating specifically with the Money Follows the Person project, and therefore will have access to these additional services as a participant in that program, again in an effort to provide an opportunity for a successful transition from an institution to the community. As I mentioned in my introductory remarks, it's been proven that housing and transportation remain one of the most significant barriers to successful transitioning for individuals moving from the institutions. And therefore, we have put forth considerable effort in closing that housing gap because of that struggle, and that the housing, transportation, and long-term support stakeholders have formed a task force to identify and work with this particular challenge, and with a goal of developing an annual housing and transportation action plan to increase options for seniors and people with disabilities across the Commonwealth. The annual housing and transportation action plan will address both creating affordable housing as well as making accessible transportation available, and then connecting the two together. All too often, housing and transportation are not linked together, and what we found is that they are critical to have in the same place. If you have brand new housing or housing opportunities in an area with no transportation, it's difficult to access services, and vice versa with transportation but no housing. So looking to create opportunities for better linkages between those two systems, and then to develop lasting partnerships among housing stakeholders and human service system stakeholders. I've been in human services, I'd say almost 10 years now, and I thought this was complicated. Well, housing is an extremely complicated system, and quite frankly, I think that you'd be doing pretty well if you could understand just one. So understanding both is quite a task, and but the task force, the housing task force, will be bringing those subject matter experts to the table, all to the same table, to begin understanding what Medicaid is, what the waiver programs are, and then understanding the housing and what different the plans are with regards to housing plans and the development of those plans and how they can be influenced to better benefit everyone. In addition to the Housing and Action Plan, the 16 Centers for Independent Living will also be assisting in this effort by working with local housing and human service agencies to address the housing needs specifically with individuals with disabilities and seniors, and assuring that these needs are incorporated into the housing plans. It's kind of step one in a process that we need to ensure that when they're developing their housing plans, that these two populations are considered, and that appropriate housing plans are designed to meet their needs. And then to track the related policy changes as it relates to increasing that affordability and the access for individuals with disabilities and seniors. So what are the keys to success for successful transformation of Virginia's long-term support system? Well, it's important that we all work hand in hand, and state and local agencies, private and public providers, advocates, people who currently use long-term supports, and their families are all around the table, and all of us working together to improve and to transform Virginia's long-term support system to better support individuals' needs, and to have a common vision and goals, as well as a passionate belief that we truly can do better, and that the three key initiatives that we've mentioned today, a systems transformation grant, the Money Follows the Person rebalancing demonstration, as well as the state long-term support profile tool grant, are just vehicles in which to get us to that transformation, and that we're very excited about these opportunities. Now, not necessarily the questions you might have, or you might, or perhaps those that you serve might have, and as a result of if they hear about Virginia's transformation of long-term support systems. And first, do I really have choice about my supports? And the answer is yes, you do. And that, do I have right to choose where I live, be it an institution or in the community? And the answer is you do. As well as, do providers need to honor my choices? Well, of course, that answer is yes. Other questions, again, that might considerably be in the audience, or again, with the population that you're serving, include, will transformation create more community living options while keeping institutional living options available? And it will. This is, again, providing a choice for individuals so that they have the opportunity, if they choose to receive their services in the community, that can happen, as well as if an institution is their preferred setting to receive their services, that will, of course, still be available. And will people have more opportunities to use their job skills in institutions and in the community system as a result of the transformation? And yes, they will. And will there be safeguards for people who want to live in the community? And yes, they will as well. So after all, it is about your life, your choice, and your home. And the last slide is the contact information for the three initiatives. And it's a little hard on the screen, but I believe it comes through on the handout. Kristen Burhop is our Systems Transformation Grant Project Director, and her contact information is there. I'm there in the middle as the Money Follows the Person Project Director, and Karen Lawson in the Department of Medical Assistance Services, the Policy and Research Manager, is overseeing the state profile tool, and her contact information is also available.